A very good evening. This is Mr. Mark Blazer, Sales Director Africa for Schiller. And I would like to take the opportunity to present you the Argus Pro LifeCare 2 monitor. So this is a 4.5 kilogram monitor with full diagnostic ECG, 12 lead ECG. This is full diagnostic, not only monitoring, full diagnostic with printer. Here we have the numeric values for the monitoring, SpO2, NIBP, capnometry, and then the curves. Whereas on the first page you can see the 12 lead ECG interpretation and then the ECG curves. That's about the ECG. Then we go for the monitoring function. For the monitoring we have your SpO2 with pulse, your NIBP, capnometry with curve, and invasive pressure, and also 2 temperatures. So this is a monitor of surveillance to monitor your patient's situation. Let's have a look at the accessories now. So here we have the ECG cable. There are 2 parts, 4 and 6 leads, which are connected to the disposable electrodes to acquire the ECG. Then we have the temperature probe, which can be used to measure temperature on various areas of the body. Then we do have our SpO2 state-of-the-art Massimo sensor. Then we have our face-in capnometer, where you insert a mouthpiece and then inhale it in order to see the situation of your lungs. Then we have our NIBP cuff with tube for acquisition of non-invasive blood pressure. And then last but not least we have the invasive pressure, it's this one. And here you need to attach a transducer which will enable you to do the measurement. So these are the first 2 devices, a 12 lead diagnostic ECG and patient monitor for critical care. Now we enter to the defibrillation mode. For the defibrillator we have 2 modes. It's an AED, automatic external defibrillator.
Press analysis button. Do not touch the patient. Analyzing. Check the electrodes.
Now it's not proceeding, the AED, the defibrillator, because I didn't insert the electrodes. These are the electrodes for the AED. These are pads, which have to be connected accordingly on the chest, on the upper and the below.
Check the electrodes.
Then with the same pads, you can also do a transcontinuous pacemaker. I come to that in a short while.
Immediately resume CPR. 30 chest compressions, then 2 rescue breaths. Continue until patient is breathing normally.
So there it comes, the device Schiller Easy Pulse, which is presented to you in a separate presentation. If this message appears, you please mount the Easy Pulse as soon as possible to the patient and enable him to take CPR, 30 chest compressions and 2 rescue breaths. Then, as I said, with these electrodes, we can have an external pacemaker in 3 different modes. It's a manual one, fix or on demand, in order to stimulate the heart rhythm. That's another device included, external pacemaker. Then for the defibrillation we can also do it fully manually with the paddles. Obviously each side includes a paddle.